Well, hello everyone, and welcome back. I hope you had a chance to, walk around a little bit, get maybe a snack and something to drink, refresh your coffee. We're joined now for a special event, the 7th inning stretch. We won't sing, but we do have a special guest named Rebecca Shook. She's a physiotherapist who has been with Providence Healthcare for almost 25 years now. And she is currently the physiotherapy site lead at Holy Family Rehabilitation Services. And that involves both treating patients and educating staff and students. And Rebecca's going to take us through a number of 7th inning stretches. So Rebecca, take it away.
Okay, so good morning, everybody. So I hope you're all enjoying the sunshine that we've had for the past few days. For me, the sunny weather always lifts my mood. Besides the sun, exercise is also a great mood booster. Therefore, I wanted to share 5 facts about exercise with you. So, fact 1, adults should aim for about 150 minutes of moderate to vigorous exercise per week. So how hard should you be working? So you should be able to talk in short sentences, but no long monologues or singing. Fact 2, there are different types of exercise. So there's strength and balance exercises, endurance exercises, and flexibility exercises. And all of these are required for good health. Fact 3, but exactly what kind of exercise should you be doing? The excellent thing about exercise is that anything that gets you moving and working counts. So exercise only benefits you when you do it. Unfortunately, as soon as you stop exercising, the advances you gain from that exercise start to fade away. So therefore, an ideal exercise is one that you enjoy and that you want to keep doing. So gardening is good exercise, as is walking. And housework, unfortunately, can count as exercise, as anyone who has hauled around a vacuum can attest to. Tai Chi is good for balance, and yoga helps with flexibility. So fact 4, there is a great benefit from mixing up exercises, because the novelty can kind of stave off boredom, and varied exercises can touch on all the aspects of the strength, balance, endurance, and flexibility that I mentioned before. So good exercises, the good exercise program do several things at once, which makes an efficient program. So fact 5, you don't need special equipment to exercise. Just your body weight and a safe space with a place to stand with solid hand support, free of obstacles. While activities in the community are kind of curtailed because of COVID, I'm going to show you several exercises you can do at home. Because of the time frame I have, I'm only going to show you a couple of repetitions of each exercise, but you can adjust this and do more or less depending on how you're feeling and how hard it makes you work. So the exercises that I'm going to show you are called sail exercises, and that's the name of the program that was developed. The program that was developed. So the first exercise is sit to stand. So you're just going to sit in your chair. Depending on how strong you are, you're going to either use your hands or not use your hands. You're going to come forward and just stand up. And then you're just going to sit down again. You're going to do this a few times. This is good for balance and for strength. I'm going to switch my chair around. So I'm demonstrating exercises. You just want something solid and heavy to support yourself if you have any concerns about your balance. So the next exercise, although you can't see my toes, you're going to have to trust me. You're going to go up on your tippy toes and then back down, and then up and down. If I'm holding on, this is a good strength exercise for my toe push off to help the gait. If I don't hold on, it's good for my balance. So up and down your toes. The next exercise and again, I'm afraid you're gonna have to take my word for it, is you're gonna do toe taps. So think of you've got a clock on the floor, so you're gonna tap your toe at noon, you're gonna tap your toe out at 3 o'clock, you're gonna tap your toe back to 6 o'clock, and then back to the center. And you're gonna do that with the other side as well. Noon, 9, and 6. Just around in a circle. Again, if I'm holding on, it's a good strength exercise. If I let go or just have a light fingertip, it's good for my balance. Okay, the next exercise is hip abduction, or it's hip. It's moving your legs out to the side. Hand support, trunk nice and straight. You don't want to be bending or twisting, and you're just going to bring your leg out to the side and back in. I'm pretty flexible, and you can see that my leg doesn't actually come all the way out to the side. You don't want to be leaning over like this, nice and straight, just out to the side. And if you're doing it right, you're going to feel it in your glutes. The next exercise is stepping back, or bringing your leg back behind you. So same thing, I'm staying nice and straight. I'm trying not to arch my back. Just bringing my leg out behind and back in. Again, this is a glute exercise. And you should feel it in your glutes. Your glutes are muscles that get weak really easily, and they're really important for stabilizing your pelvis and for helping you get from sit to stand. The last exercise I'm going to show you is just mini squats. If you're concerned that this might be a little hard, you can do it with a chair behind you, so if you need to sit down, you need somewhere to rest. But you're just bending your knees, going down a little bit, and then coming up nice and tall. This is down and up. Yeah, so I hope that's warmed you guys up a little bit. So all these exercises can be found on a website called at findingbalancebc.ca. So the really cool thing is that there's video versions of these exercises and PDF versions with pictures and instructions in English, in Farsi, in Chinese, and in Punjabi. So it's a really good resource if you want to do these exercises at home on your own. Yeah, so that's what I've got for you. Is there any questions?
Thank you
now that
so
I'm
much.
all warmed up.
Thank you so much, Rebecca. I know I'm feeling refreshed just having watched you do those exercises.
Oh, good.
And I was making notes of them here for myself, but also for my mom at home, because it's a good reminder of things that we can do at home, and to focus on those 4 areas of strength, balance, endurance, and flexibility. Thank you so much.
You're welcome.
So we're going to start our next session now, and it's going to be a roundtable discussion. We have a panel of experts with us, and the topic will be staying healthy at home, navigating the healthcare system during COVID-19, and transitioning into the new normal, as long as that may be with us. So let me introduce our in-house experts who will explore these questions with us. Dr. Evan Kwong will be our moderator, and he's the medical site lead with Holy Family Hospital's Rehabilitation Services. He's the head of physical medicine and rehabilitation at Providence Healthcare and an assistant professor at UBC. We also have Dr. Nardia Strydom in the department. She is the department head of family medicine here at Providence Healthcare, and as a full service family doctor for more than 25 years, her patients are newborns, seniors, and everyone in between. And Dr. Strydom wants you to know that she loves her job. And having worked with Nardia a little bit over the years, I can attest to that. Thank you for being with us today, Nardia.
Hi.
Dr. Mona Kwong is a pharmacist with broad pharmacy experience at hospitals, communities, industry, and academia. She has a special interest in chronic disease, seniors, mental health, HIV, and addictions care. Dr. Mark Falk is a geriatrician at MSJ and St. Paul's with a particular interest in drug therapies for elderly patients. In addition, he's completing his master's in patient safety and quality care at Johns Hopkins University, and he makes house calls to check on frail elderly folk in South Vancouver. Finally, we have Dr. Elliot Weiss, who is a consultant in physical medicine and rehabilitation, a specialty called physiatry. And he was the head of physical medicine and rehabilitation at Providence Healthcare for almost 20 years. His areas of interest include pain management and rehabilitation for older adults. Thank you all so much for taking time out of your busy schedules and on this beautiful July day to be with us today to share your expertise. Let's get started. And remember, please go ahead and submit your questions as you think of them with that little Q&A button at the bottom of your screen. And I'll turn it over to you, Dr. Evan Kwong.
Great, thank you, Brooke. I'm very excited to hear from this panel. We have geriatrician, pharmacist, physical medicine rehab physician like myself, and a family physician as well. So I do know we have 20 minutes here before the broad question and answer. So let's start with some comments from each of you. Here's a question here. How has COVID-19 affected or changed patient care for each of you? Can we start off, at least on my screen here, so I can have the order here. We can have Dr. Nardia Strydom from Family Practice.
Hi, Evan. Thank you so much. I mean, I think the biggest change really has been patients not coming in. And obviously for all of us, it was a very sudden, drastic change where we moved over to virtual care. But I still find that patients, especially seniors, are a little anxious about it, and they're worried about both coming out to public spaces and to a medical place, and perhaps being exposed to illness. And then they're also worried about not being a nuisance. And so I really think that sort of that big change that we now have to get used to is how we interact with each other in this new world. And for me, it's really about reassuring people that we do need to still stay connected, that we can't ignore things, and that everything is still important. And then that message about, that virtual care is not always a video, and you don't have to have the technology that we have today in order to be connected with your family doctor or your practitioner. The telephone is still an amazing tool, and we can do a lot on the telephone. So, it's just sort of finding that new space and figuring out how everybody feels comfortable. Those are the big changes.
That's very helpful, staying connected in different ways, right? That's absolutely a good message. I have here on my screen here also Dr. Mona Kwong, Doctor of Pharmacy here. Has that a similar experience? How has it affected the patient care at the pharmacy?
It's also different where there's a lot more phone calls from patients as well as prescribers and other care providers. Patients have actually come in more often too, because we are an essential service in a way that you're allowed to go to the pharmacy and grocery. So that's changed quite a bit. A lot for us after work and before work, we've actually done a lot more home deliveries to call to make sure patients are okay. Checking in with seniors on the phone, because sometimes it's often the only point of contact. And coordination has increased with the phone calls and faxes actually from different prescribers, hospital discharges, specialists. So a lot more coordination and a lot busier on that front from pharmacy.
That's great. It's so common theme again, coordination, communication, it looks like. Eh? I have here also Dr. Mark Falk from Geriatric Medicine. How has it affected the care in your practice in geriatrics?
Thanks, Evan, and thanks for having me. It's been very challenging in many different ways. As you can imagine, I work in a hospital or in a clinic setting, and so the biggest challenge is wearing this and trying to communicate with patients. And so we lose a personal touch, right? People can't really see your facial expressions. They can't really understand you. And I think that is the biggest challenge and things that I have to adopt to as I see my patients. I work in a hospital, and I work in a clinic as well. And so as Nardia has mentioned, we initially saw a big decrease in the number of patients actually coming into hospital. And so the wards were fairly quiet. There was a big valve, and more people are coming into the hospital. We also find that in the clinic as well. Our clinics have been closed, but now that we're slowly opening up, and so as Nardia has mentioned as well, there's been a lot of virtual care, either by phone or video conferencing, but it's been challenging in many ways. Many seniors don't have internet, many of them don't have a computer or tablet, and so the good old home visit is very challenging in many ways. I see some home visit patients as well, and I just have to go ahead and see them wearing a mask and full protective equipment when I go see them as well. So it's a different new reality that we have to face, and something that we'll just have to get used to.
Thanks, Mark. That's great. No, I just definitely see that with the mask, and I see some of the clinicians and therapists using these photos of their faces and trying to introduce more verbally, right? So that's great. We have also physical medicine rehabilitation or physiatry, Dr. Elliot Weiss here. How has it affected your practice?
Thank you, Evan. Good morning. It's very interesting because we're doing more telephone consultations. Many of our older patients don't have the technology or are not adept with the technologies that our younger patients have. So we call it the POTS, the plain old telephone system, is actually a very good option. For me, it's forced me to be a better listener. If you can't see the patient, if you can't touch the patient, then you have to rely on improving your telephone skills. A couple things that I find interesting is patients are actually interested in how I'm doing. And it brings up the fact that we're all facing common challenges. So instead of it being more of a one-way dialogue in terms of how you're doing, we need to talk about how we're all doing. And what we can offer to our patients is an understanding of what's going on in the world, how COVID has changed things. And in fact, I've had some patients tell me they like some of the aspects that COVID has introduced. Things are a little slower. They're calmer in some ways. From my perspective, I don't have to get my hair cut as often. But that's a side point. In terms of my interaction with patients, though, rather than talking about their back, their shoulder, etc., I try and talk about COVID and how they're doing, and figuring out whether social isolation and the consequences of that is an issue for them. We talk about how to access care. It's about being more available for them. But at the end of the day, it's really about just being there to listen, especially with many of my older patients who are more socially isolated. And I think they appreciate the contact. Thanks, Evan.
No, thanks. Those are really good points. I definitely see that in terms of the telephone consults and whether or not it's people being more comfortable in their home and they're able to share, and they're so used to these conversations with their friends and family. They do have a lot more to share, and the history is quite rich actually with the telephone. I'm curious with this common themes about communication, just to go on with this a little bit more in terms of your own areas in the pharmacy or in the clinic. Have you also noticed that communication? Let's say Dr. Kwong here.
Yeah, yes. I've definitely noticed that communication, and also when patients come in, some of our patients are challenged in that they don't have access to a phone. So we actually call for the patient to communicate with their other care providers. And also the communication and listening is, like what Elliot was saying, is so important, just about the tone. If there's some, mood issues, perhaps, eventually it does come out, and then we can coordinate a bit more in the care.
How about for you, Dr. Strydom, the family practice, has the communication changed a bit there too?
Yes, it has. I mean, it is one of the gifts that I have as a family doctor, is that most of my patients I know and have known for a long period of time. So when you have that relationship, it really makes some of the more challenges around communicating now a little easier. Although I have noticed that for some of my seniors in particular, they still struggle with the concept of a telephone call even, and with booking it and getting all that stuff done. And many of them have really asked to be able to come in to be seen. And the other thing that I've really noticed is for some reason I have more patients than normal who have wax in their ears and they're coming in to have their wax removed. And I don't know whether that's because they're, spending more time on the telephone and in situations where they can't look at other, visual cues for communicating. So they're more aware of their hearing loss, but that's
right.
a funny aside in the last few months. I have to have my ears cleaned out.
Definitely, hearing and sight so important.
Yeah, we forget about those bits, Yeah.
Absolutely. I see Dr. Falk is unmuted there. Yes, you had some comments as well?
Absolutely. It's been interesting because there are some patients who have mobility challenges. For instance, they need to mobilize using a walker or a wheelchair. So to actually physically come into the clinic is quite challenging. People sometimes have Parkinson's disease. They may have had a stroke. And so what I found is that for some patients, it's actually a bit easier if you can do a virtual consult. Usually they live with family or children who have a computer, and we can do a virtual consult over the phone. And so it saves them some time in terms of getting to the hospital, to the clinic, to where I work, and assessing them and getting that back to the car. So in some ways, it's made it easier. And I think there's going to be some patients who benefit from virtual care moving forward.
Sorry. The access to care, right? So that's of interest. Like, I'm sure people are interested in staying healthy. How do you think they can stay healthy to access the pharmacy services, geriatric family physician services? Like Dr. Strydom mentioned at the very beginning, she said some people may find it's a nuisance or something, but I'm sure that we all want to take care of you and find different ways of accessing the services. Are there other tips for the seniors to stay healthy during this time and access their services? You can start here with, let's say, Dr. Weiss for accessing physical medicine rehabilitation.
Well, I like Mark's model. His clinic is on the beaches of Hawaii. So I prefer to actually go see him rather than talking to him and listening to the sound of the surf when we're chatting on the phone. I think it's really about something that we're talking about more and more, and the term is connectivity. And how do we connect with our patients individually? How do we connect with them collectively? And one of the things I found, since my mother is in a assisted living facility that's had to deal with COVID, is not just the phone call, but really talking at a more personal level with our patients. And also the number of calls, because, calling once a week, if you don't have a lot of good social supports, is probably not enough for people. And I think one of the ways of really changing that is to expand your social networking, so we're supporting each other.
That's a great comment. I find the same with our family and also with patients. And I'd like to bring that point up that you had again about them actually asking how you were doing. And I find that is happening as well. And that does have that connectivity component to it. Absolutely. Dr. Strydom, you're nodding there. Is there other comments about connectivity or improving the access to services that seniors may need?
Yeah, I think that now is a really good time as well for all of us to think about the things that we enjoy doing and sort of almost to practice, and so I've been encouraging my patients, especially those who are living alone, to really think about who their buddy could be going into this next phase and to sort of to go, well, these are the things that I like doing. These are the things that I always wanted to do. And so let me try and see if I enjoy them now. And then sort of how am I going to sort of plan ahead and sort of like, who's my buddy going to be that I do feel safe with and that I can actually do these activities with, And so if you practice walking 2 meters apart now, then you'll be in good stead for when we need to sort of get a little bit stricter again and when we get more worried. So I think those are, it's a lot of it is stuff that we know how to do and that we're doing already. And it's just confirming that those things work really well.
That's great. Thank you. That buddy system or expanding your bubble, that's a good segue into that question that I was going to ask was how do you keep the seniors who may be living on their own, they may feel lonely or isolated, but yet we want them to be engaged. We want them to do exercises. We want them to see people get socially connected. Does anyone else have other tips on that topic about keeping seniors engaged, but some of them may be on their own or isolated? You have Dr. Kwong, Mona Kwong.
I echo what Nardia was saying, that we do mini goals with our check-ins, because oftentimes the patients call the pharmacy a lot, or they pop in a little bit more often than some of their other medical providers. So we set mini goals, you know, talk about the buddy system, you know, ask them, so did you manage to do this exercise this time, and how many times? So really encouragement is so important. But again, they encourage us the other way to make sure that we're okay too, and that we're keeping healthy. So it's a two-way street, which is amazing in this realm of care right now.
Dr. Falk, you do some home visits. Do you have those conversations as well, getting them to be a bit more engaged, and even though that they're on their own and you have to actually go to them to see them?
Yeah, what I'm finding is for those that have family and close friends, it really shows where they are getting their supports from. So whether it be from siblings, nieces, cousins, neighbors, even helping into chip in. I've seen a great deal of community out there helping some of the seniors. Not everyone is as fortunate to have family. And so for those who are very independent and are eager to go out, I just remind people, keep in mind these four things: time, people, place. This is from an epidemiologist in Ohio State who came up with this. And he said, think about the time you spend with people and the distance that you spend with them. The more time you spend with people and, if you're in close contact with them, that increases your risk of contracting a disease. And people and space refers to the more people you are out there with, the more exposure you're at risk to. But if you keep your bubble small, that would be the way to go. And space refers to how, outdoor spaces are less of a risk than indoor spaces. So if you do have a meal with friends or family, try have it on the outdoors, because the wind dissipates some of the droplets. There's this risk of exposure. So time, space, people, place was something that I read about that I think is very useful to teach to my patients.
I love these strategies people are saying. You got the buddy system, then you got time, people, space, and place. Sorry, the rhyming there. Does anyone else have any resources or strategies for those that are feeling lonely or isolated? We have Dr. Weiss here.
I was thinking about this morning, about the 3 Ps for phase 3. And the first one is planning, that we need to plan our days so each day is different than the next, so we have some variety. Otherwise, how do you differentiate one day from the next, and how do we stay invigorated? The second thing is to prioritize. The second P, priorization, referring to what's really important. And if we don't highlight the things that are important to us, then everything becomes ordinary. And we need to have things that we look forward to, whether it's, do I give myself special treats in the way of food, things that are important to me, things that add value to our life. And we need to figure those out because they're very individual, and not ignore them. And the last thing, which really is the opposite of the bubble, which is how do we participate but maintain a safe environment through social distancing? And I think the concept of isolation does not mean you shut yourself in. I think what it does is you limit your the opportunities to be exposed to COVID and other things out there that may be harmful to our health. The last point, thinking about what Mark was saying, because whenever I see Mark, I think he should be wearing a Hawaiian shirt. The people that are not engaged today. The people that don't have good social networks, the people that don't have good advanced telecommunication, those are the ones we should worry about the most. It's not the people that are engaging, that are motivated, that are enthusiastic about this. It's the others. And my mom reminded me of this because she's in this facility. And she knows that there are a lot of other residents there that are not leaving their units, their apartments. They're not interacting, and she sees them physically and emotionally and cognitively declining. And as you get older, when you lose it, it's much harder to get it back. And I think we really need to focus on the people that are not engaging.
That's great. Yeah, go ahead. Yes, I was thinking about pharmacy in that actually.
Comment. What's really interesting is other patients that are coming in that are very engaged, they actually ask us, how can we engage individuals that might be isolated? So they want to know what kind of services that they can volunteer in to help people that are isolated, whether being, getting access to medicine or access to groceries or access for even a simple chat. So that's been very different when the conversations that come in at the pharmacy from other patients.
Thank you. Yeah, I was curious because in the pharmacy you have a whole wide breadth of people coming in, not just the ones that you do know. So that's really important. Some of you highlighted either friends or a social network or caregivers. I'm curious because we do see the patients come into the clinic or on the video, a few of them at the time, which is the great thing about it. Sometimes it's not actually in the same city. Some people have been able to call in from other places actually. For family who are not in the same city. How do you have any tips or strategies, resources for the caregivers that may have been touched upon a little bit on the dementia session in the morning, but for the caregivers, any strategies to help them deal with any potential burnout or cope with all these additional things that they may have to do during the COVID pandemic? We have, let's say, Dr. Strydom, since you're on the top left of my screen, if you don't mind starting that conversation.
Yeah, I think that it really is perhaps sort of that little bit that Elliot mentioned about planning and sort of, the first thing I want to say, actually stepping back to both the patients and the caregivers is I think that we've all survived the first round of COVID and we had no time to really think about it and plan ahead. So we all learned a lot of really good lessons there. And so I think we could look back at that and go, okay, look at what really worked and then look at what didn't work during that time and how we can better prepare for that. So that would be the first thing for both patients and care providers. And then I think for care providers is really understanding when we're interfering too much and we're becoming too bossy with our parents or our siblings, and when we need to step up a little bit, because I think that sometimes we take on more than we need to, and our family members actually want us to give them a little space to remember that as well.
Those are great points, that fine balance, right? You definitely see that. We have a little bit of a short amount of time just before the Q&A. Maybe I'll get one more comment from if you don't mind, Dr. Fox, since you may see many caregivers in your geriatric practice. Do you talk with them much about burnout and caregiver challenges?
Absolutely, it's very challenging. As you can imagine, with the closure of community pools, libraries, adult day programs, many seniors who used to attend these facilities have now had their activities curtailed, and so they, for several months, stuck at home. And this has taken an increased toll on the caregivers. The main message is really to the caregivers is to try and take care of yourself, whether it be reaching out to other family members to try help out, whether it's asking a friend to come and help watch mom or dad for a couple hours so you can go out and take care of yourself. Getting enough rest is going to be important. So that self-care is critical because if you don't take care of yourself, you can't take care of your loved ones. And so it's a struggle. There's not a lot of options out now, but as things open up, hopefully there'll be more opportunities for seniors to go out and engage in the community with some of the activities that were stopped previously.
Mm-hmm. Great. That's been a great intro discussion. There's lots of tips today and lots of little 3 and 5 pointers, from Rebecca's exercises to the 3 Ps of planning, prioritize, participate. You, Mark, so you got the time, space, people, place, lots of tips, but I would say we'll have to start slow and start small, right? So even that 3 Ps is interesting just for the planning point of view. What are we going to plan tomorrow now that we've participated in some of these discussions, rather than try to take it all at once? So again, I do want to encourage the question and answer Brooke mentioned. You have this Q&A part on the menu. There's several there as well. Once you type in a question, you can just type submit. If there's questions you can actually see, and you can vote it up and put the thumbs up button on the right of it. And then we'll try to answer through the group over here. So we have another 20 minutes here for more questions. So I think I'll start here. Excuse me, I'm just going to bring up the screen here. So I'm going to start from the top here. Okay. So I am seeing a cognitive decline in my father. I would like to help him, but he also has COPD, and I'm worried about him going out. Should I encourage him to see his family doctor, or is there another way he can get diagnosed? Let you read that. I think the panelists can read that as well and gather your thoughts. I mean, I do believe in primary care, and I'll go to Dr. Strydom again.
Absolutely. So, you know, I think there are a couple things that we can go over. So most of the time what we're trying to do in family practice, and I think in specialty care as well, is we'll often start off with a telephone visit. So that I would encourage you to book an appointment for your dad with his family doctor, and then you can have a conversation over the phone. And during that conversation, we can then sort of go, okay, this is something that we can deal with over the phone, or this needs an in-person visit. And then we'll get the patients to come in and actually see us in the office. So we're absolutely working both in the office and on the telephone. And then I think the thing to reassure everybody about is that we're really working hard to make clinics and hospitals safe places for patients to be, so that care teams are not coming to work when they're sick. We're wearing protective equipment. We're cleaning spaces. We're making sure that patients can sit in waiting rooms for short periods of time. So all those things that make it safe to be in a public space, we're doing in healthcare as well, so that when you do need to be seen, and you should be seen, we can help you do it in the safest way possible. I hope that answers that.
Thanks. We'll have a follow-up with that. This is another question. I was going to go. I was going to go to. Let's go to Dr. Weiss first, and I'll go to pharmacy since COPD was mentioned. Dr. Weiss, you've had some thoughts. Oh, can you? First time to say. Can you unmute? We went a full 25 minutes before saying that. It's a record, I think.
I just wanted to ask my colleague, from a family practice perspective, can she comment on continuity of care versus some of the, without naming names, without talking about the so-called call-in, walk-in clinic type of service that you can get out there with telemedicine, how important it is to maintain consistency with your primary care providers?
Yeah, I mean, I obviously believe in that. I've been in the same practice for over 25 years, and that really does make a difference, because I know my patients and I often know their families, and I know the dynamics, and so I can really get a better sense of what's going on with the patient and the things that I may be more worried about. You know, not everything that looks like COVID is COVID, and so we also have to remember that we need to sort of think about bigger picture things as well. And so I think it's really important to see your family doctor. Not everybody has a family doctor, and so we need to work harder at solving that problem as well. It's certainly something we need to do.
Thanks for that question. I certainly get those advertisements and emails, and I'm lucky enough to share a family doctor with my father, actually, who accesses the services in his 80s as well. So that's good to know. I was curious just from that question about someone who has cognitive decline and COPD, from COPD from a pharmacist point of view. Do you have people coming in concerned about that?
We do, and we also have people coming in concerned about how to use the medication. So because similar to what everybody is saying, it's really important to keep the same pharmacy as well, because we know, I've been practicing in the same pharmacy for about 20 years, so I know when tones are changing or something's just not quite right with the patient coming in. So I do provide, simple direction on how to use medication for COPD, for example, or I do home visits. A lot of our pharmacy colleagues are doing a lot of home visits right now, similar as what Dr. Falkmark said with proper PPE, etc. That's what's been happening, and then the same thing, coordinating care if we need to. Great,
thank you. I know it looks like there's several questions here, so we'll see and try and get through most of them. If not, we may have some follow-up that's needed. This one here is a comment and question. I've been scared to go to the doctor's office, but I need to. It has been comforting to hear encouragement from Dr. Strydom to go in. Is such messaging being broadcasted more widely to reassure those of us who need to visit a doctor in person, but are scared to do so? I've seen certain things from divisions of family practice or whatnot. I'm not sure if there's anything else that people would like to comment on for their own specialty or family practice in particular. Dr. Strydom, is there anything that you know about for wider communication?
Yeah, I mean, I actually think that we are scaring patients off a little bit, and there are some people who are worried about it. And I think that as a profession, we actually need to do a better job to reassure patients that it is safe to seek care. I mean, you mentioned earlier, Evan, that we've seen huge drops in numbers of people coming to the emergency department and being admitted to hospital and coming in looking for care. And with that, we've seen people who haven't done as well as they should have because they've avoided care. So I think that as a profession, we need to do a better job ensuring safety. And we are working hard to try and get the message out there, for sure, both for providers and for patients.
Great, thanks. I think Dr. Weiss had his hand up as well.
Thank you. I have to double press the mute for it to work because I have the questions up. I think we need to differentiate between what is a rational fear versus an irrational fear. And Dr. Henry's been very good about explaining what should be a safe practice. But I think based on some of the questions, there's an element of irrationality with regard to her fears that isn't quite supported by what she's saying. And I was pointing out before that isolation does not mean locking yourself in your home. And yet when I'm having a lot of phone calls with people, that's exactly what they're doing, and they don't necessarily need to. It's all about appropriate hand washing, distancing, wearing a mask, primarily to prevent other people from getting an infection, COVID, from you, rather than protecting yourself. And I think we need to really challenge ourselves and figure out really what is irrational fear, and if it's irrational, we need to really think about whether we're doing ourselves any services.
Great comments, and I see this. I know this topic is not just for seniors here. I actually see that in the younger folk that we see in their 20s, 30s, and 40s. The similar comments actually, so that is pervasive. I do like. Oh, Dr. Falk, you've got a comment there.
Thanks so much. I also wanted to add, from what we've seen in the hospital, in the emergency room, is that people are delaying seeing their family physicians to the point that their chronic conditions may actually be getting worse. And so when they come into the hospital, they do seem a bit sicker because they've been delaying. And so I'd really encourage people to go see their family doctors if they need to, touch base via phone or virtual if need be, or in person, because people are, avoiding doctors' offices. And I think many clinicians are seeing some of the effects of that when people coming in a bit sicker than they usually would have.
That's great, and a common message. Call your family doctor's office, see if they're open. I've had people who haven't even called and even asked, so definitely check to see what precautions have been done because people are trying to help. That's great. Okay, we've got another question here. What has been the most creative adaptive solution that you've seen within your own practice since COVID? Yeah, let's see if anyone wants to volunteer first. I know Dr. Falk mentioned mask wearing, and Dr. Strydom has mentioned virtual care. Dr. Weiss has mentioned connectivity. Anyone like to go first here? You can put up your hand. I'll just go right on my, oh, you have an unmuted microphone here. Okay, go ahead.
We've actually planned routes based on who needs visitation. So a lot more visitation. So mapped out a bit of downtown to coordinate and, you know, be back at the pharmacy on time to open regular hours. So that's what we've done.
Okay. So you're talking about your delivery of medications.
Delivery of medications,
okay.
and sometimes we have students and they get lost sometimes. So creatively, trying to get them to read a map instead of looking at their phone. Yeah.
Okay, the paper map system, that's great. That's great, you're trying to be efficient, right? Yeah, that's great. Dr. Weiss, you put your hand up there, and then Dr. Strydom afterwards.
So Evan, you know this as well. So we can assess our patients through FaceTime, Zoom, Skype, Doxy, plus some of our electronic medical records will actually let us do a video conference. And the most interesting thing that I can comment on is how we're trying to do a hands-on physical examination via a video link. And getting patients to do things that we would normally do hands-on, and they do it for us, and that helps us identify what's going on with them. So I think different ways of doing our business using what we'll call advanced telecommunications is probably the most interesting thing we're doing.
Yes, thank you. Dr. Strydom, you had a comment on.
So in my practice, actually what we did, and it's not really anything super fancy, but we just really started making lists of patients with different conditions and needs. And the first thing that we did is we started phoning, and we actually did. I phoned all the patients in my practice who were over the age of 70. And it was just kind of like a cold call. And it was really just to check in and see how they were doing. So it was about a month into COVID when my colleagues and I just realized how potentially isolating this was. And so we just phoned everybody and we checked in with them, checked in just to understand, you know, who was looking after them, did they have all their medications they needed and stuff like that. And it was incredibly rewarding because it really cemented those relationships, and everybody felt cared for, and we cared for them. And so it was a great learning experience for our group in terms of actually reaching out to patients rather than always having patients coming into us.
Mm-hmm. No, that's great. So you touched on being more efficient in the day, touched on the different technologies. Some have been using beforehand, but it's even accelerated it. And then this reaching out, and that does touch on that topic we talked about before, about your concern about people that are more isolated and may not be engaged. And the cold call, actually, this actually relates to one of the other questions coming up. But yeah, that's outreach is great. We have this acronym that Dr. Weiss had mentioned earlier. It says POTS user here, meaning the telephone system, plain old telephone system. This is my first virtual event, so congrats, thanks for joining us, it's great. Well, hospitals provide more support if they're shifting to technology beyond phone support. That's interesting. I'm not sure if there's anyone here that can comment on the hospitals providing support, but maybe in our own clinics, is there any other thought about that? While you think about that question, I remember several years ago, I had a 92-year-old in my practice who had a challenge with hearing, and she actually requested appointments to be done by email. And funnily enough, this was 3 or 4 years ago, I had just trying to set that up, and I actually could not offer that to her as a 92-year-old requesting appointment reminders by email rather than these traditional phone calls. So there are some that can use technology, and if they do, how else to support them? Dr. Weiss, you have some comments.
Well, you know, I've tried FaceTime, which is an Apple product. I've done Zoom, I've done Skype, I've tried Doxy, I use my own EMR. The hospital will provide some support for some of these technologies, but not all of them. But the biggest problem I'm having is that the patients either don't have the technology, they don't have the plan or the bandwidth, or we just can't get the thing to work. So we already are introducing a lot of inefficiencies in terms of how we're practicing. And then we're encountering these technologies which are really not either designed or haven't really been perfected to meet this need. So the best one I've got, really, the one that seems to work most of the time, is the Apple one, but not everybody has Apple products. So it's work in progress.
Yeah, I would say the same. We're trying to be adaptive and trying to do various ways. I've even done video plus the phone in my hand because the audio wasn't working. So it has worked in combination. Dr. Fott, you unmuted as well. Go ahead.
So I just wanted to comment that last week I saw a patient via Zoom, and the patient was hard of hearing, so there was no way they could hear my questions, but I was able to type the questions in the chat box and ask my questions, and he would be able to answer it because he could read. And so there are ways that, you know, hospitals, for instance, the health authority has provided us with Zoom, I guess, logins that we can use. But Elliot, as Elliot mentioned, it really depends if the patients or the families have the technology and the ability to use them effectively. I think it's still a work in progress, but certainly I'm seeing some abilities where they're actually beneficial.
Great. I do know that there's several questions. We have time for a couple more. Let's see where this one takes us though first. My mother is waiting for hip surgery that was postponed during the pandemic. I know surgeries are being rescheduled again. How long is waitlist, and what can I do? What can I do to help support her right now? I think with the panelists here, we can probably try and help the second question. We may likely not be able to answer the first one, not being in that area. Anyone would like to start first? Or certainly in physical medicine rehabilitation, we see people with various bone and joint issues with waiting for hip surgery or pre-rehabilitation or prehabilitation. Dr. Weiss, would you like to comment on that, how to support them right now while they're waiting for hip surgery?
Well, I think there is a provincial wait list. So there is an answer. We just don't know what the answer is in terms of how long the waiting list is, but I know it is being prioritized by the health authorities. We also know that pre-surgery rehabilitation improves outcomes. So the better shape you are before you have your hip replaced in terms of range of motion and strength, the better your recovery afterwards. So I would go back to your physiotherapist. Some of the orthopedic surgeons might also provide it with an exercise regime you can follow while you're awaiting surgery.
Great, great tips. Absolutely. Prehabilitation or rehabilitation prior to surgery. Yes, there is a provincial wait list, and yes, BC is prioritizing. Not sure if it's updated live. We have a question here, although I do like a couple of questions coming up though, but because of time. What can I do from home to ensure overall positive health during COVID? We heard a little bit about exercise, a little bit about staying connected and socially and whatnot. Not sure who to start with. This can be anyone to start with first, actually. Yeah, either Dr. Strydom or Dr. Kwong. Would you like to talk about how to ensure overall positive health from home?
Well, you know, there's all the things that we hear about, you know, trying to, you know, the usual things about eating healthily and I mean, for me, and it sort of gets to the next, one of the next questions about practicing self-care.
Sure.
It's sort of staying connected. So, you know, like I really think relationships are important. So like during this time, really staying connected with people, making sure you're supported and you're supporting other people. You know, I like to exercise and encourage people to do that and eat healthily. And then don't listen to too much stuff that doesn't make sense. You know, if you're reading something that tells you should have a drink with, you know, lemon and bicarb in it every day because that's what, you know, prevented everybody from dying, it's probably not true. And so I think that we also need to really be careful about what we listen to and what we absorb that increases our anxiety about stuff as well. I think that's an important piece.
Thank
Mona,
you.
you've got something to add to
Yeah,
that, I know.
It's so important to laugh, like really laugh, you know, tell the jokes, tell the stories, laugh, because we don't hear it as much now. Don't keep your eyes on the news. Don't keep your eyes or ears listening to the radio all the time for the news, because it's too much. So really important to laugh, do silly things. That's what I do with some of my friends to practice some of that self-care. So those are my tips that I've shared.
Oh,
Can I make a comment, Evan?
yeah, make a comment, a couple more comments from you, and then maybe Dr. Falk to close, and then.
Well, you know, I try and talk about Mark and, you know, Hawaii and his Hawaiian shirt, but it's really hard to be jestful with technology sometimes. But I'd like to turn the question around, and I'm just going to go back to it in terms of what can I do from home to ensure overall positive health from COVID. I'd say, what can you do for your community? What can you do for your family and your friends to help their health? Because by helping others, you're helping yourself. And again, I would turn that around and say we all have a role to play in terms of supporting each other.
Great, thank you. Okay, that's good. Okay. No, thank you. We definitely learned a lot today, anywhere from exercises. We have lots of tips here, definitely common themes about accessing services. So definitely phone up your family doctor, go see the pharmacist. If you have questions about the specialties, certainly they are available, and we're having all the safe precautions. So I really thank the St. Paul's Foundation today. The Vancouver is awesome. The Providence Healthcare and the Legacy Seniors Living for giving us this opportunity. We've got this multiple specialty panel here: pharmacy, geriatrics, physical medicine, and family physician. We do have some other outstanding questions, and we'll find out how to follow up with that. So I hope you have gained some tips, and I think we'll on to the next part. Brock, back to you.
Great, thanks so much. I just want to say thank you to everyone who's on the panel today, taking time out of your day, and to you, Evan, for moderating. We so appreciate it. And everybody, I'm sure, is taking away their own learnings and then going to try and put them to good use. And you know, one of the things that I took away was the treats of life. How do we continue to think about those in this time, and how do we continue to you know, activate on those? I'm going to hand it back over to Michelle Bati from the Vancouver Courier, and Vancouver is Awesome, who is going to be sharing one of those treats. It's the winner of the raffle for today's event. Michelle.
Yeah, so first of all, thank you to everybody who attended and to the speakers. I'm really blown away. This is the first time we've done a virtual event, and wow, the team at St. Paul's Foundation, you guys did an incredible job. So thank you to everybody. And to those of you who attended, thank you. Hopefully we'll be able to do another one of these. And I have a $50 gift card to Tuck Craft Kitchen, which does do takeout and delivery. And the winner of that is Sarah C. So congrats, Sarah. We will definitely get this to you in the mail shortly. So just thanks again, everybody.
Thanks so much, Michelle. And thank you, everyone, for taking time to be with us today. You know, Zoom can be both invigorating and educational, but also tiresome. Time to you know, engage with some of those tips and tricks that we learned earlier today about self-care and strength and exercise. So congratulations, Sarah C., on winning that. We'll be in touch with you about that. And of course, we will also be in touch with everybody with a follow-up email. If you do have outstanding questions that you want answered, please reach out to us. We'll do our best in order to connect you back with the experts that we've had today, or with the appropriate people here at Providence Healthcare in order to answer your questions. So thank you so much, everybody, and we look forward to seeing you at the next Talks and Tables. Have a great day.